there is a population of patients, generally, usually on the younger side, that don't have arthritis of their entire knee, and it's just one portion of the knee that is involved with severe arthritis. And in that instance, we can do partial knee replacements. And it's always been a little bit challenging for the surgeon, although we've done a very good job of putting these components in with good alignment. The partial knee replacements are more challenging actually than a total knee replacement for orthopedic surgeons in general. I think it's something that's really going to change that procedure for the better, and we'll have a great deal of more success and be able to treat many more patients in their 30s, 40s, and 50s that don't need a total knee replacement, but would mostly benefit from treating a certain portion of the knee only.